Member from North Vancouver Seymour.
Thank you, Chair, very much. I have a few questions pertaining to mental health. In January 2018, that we're aware of, at least one person died under the age of 19 of an overdose. Last year in 2017, it was 23 youth that died under the age of 19. And we know that one more youth has died within the last couple of weeks that I'm aware of. And I'm wondering what the minister will be doing to ensure this death toll is not going to increase any more of those children who are going to school.
Thank you, Member. Minister of Education.
Thank you, Mr. Chair, and to the member. I appreciate the question. I want to say a few things in this regard, and she may have a follow-up, but one of the things that has been very beneficial to me as a new Minister of Education is that our government created a Minister of Health for Addictions, for mental health and addictions. We've been collaborating with that new ministry and that new minister so from day one, and we're building a provincial strategy, working together with that ministry. In terms of available resources to stop the threat of overdoses in schools, for example, and there has not been an overdose in a BC school that has been reported to date, but there is an ever-present risk of that kind of thing happening. We have worked very closely with the provincial health officer. The recommendations from that person has been to focus on, in relation to youth aged 10 to 18, is to focus on education and prevention. So one of the items that we have worked with the provincial health officer on is to look at how we can recommend and get into place in schools naloxone kits, for example, to ensure that school staff are trained in how to use it and how there can be a timely response. If there is a person, either a student or somebody nearby using drugs on a school ground that needs an intervention that could be life-saving. So that is part of our response. Again, we're working with the coroner's office as well on some other ways that we could improve our responsiveness and our preventativeness in the school system. I would say, as I said to the critic for education at the outset of this set of estimates, that mental health is, and its relationship to addictions, but mental health improvements and services in the school system in all 60 districts in every part of the province is a key area of interest for the ministry. We're going to be focusing attention of the school sector on that in 2018 and in the years ahead. I will certainly give that member details of a conference that is being organized right now that will involve leaders from all 60 school districts and others who are practitioners and renowned experts in youth mental health services and best practices. So we're trying to get a focus of the school leadership on this issue, and we also have some school districts, one of the ones that she represents as well, that have done really amazing good things in their district, where they have collaboration and shared resources between the health authorities, the Ministry of Children and Family Development, for example, right in a school setting that addresses the needs of vulnerable kids. So we're trying to ramp up that effort. It starts with an in-depth conversation that might lead to a better strategy. But I can say to the member that additional resources have been put in place in schools, and there is an intense amount of education going on. We're also sponsoring parent education sessions so they can spot and identify issues around children's mental health and potential exposure to drugs and overdose risks in their communities.
Member.
Thank you, Chair. Yes, I'm aware of the interest in some schools to have naloxone kits, although I think it was Dr. Perry Kendall who, at the time that I had spoken to him, didn't think it was necessary. But my emphasis is more on the preventative end. The minister had just said, and I apologize if I'm paraphrasing, but I think this is what he said, is that the ministry is putting preventative measures in schools. So what are those preventative measures? I think he also said the word resources. What are those resources in the schools?
Mr. Minister.
Thank you. There's a number of things around the prevention issue that the government has done. Substance use education for safe school coordinators is one initiative that is ongoing. Communication with boards of education and independent school authorities regarding the provincial health officers' naloxone kits in schools. We have distributed teacher resources on substance use, including the risks around opioid overdose. So that's been something actually that's been shared with all of our K-12 education partners. Superintendents have been involved in a number of province-wide initiatives with the ministry. There has been a traumatic event systems training workshop that included the provincial health officer that looks at opioid overdose risk Risk assessment tools are in place for different schools and school districts, and we do have those kits available where districts have deemed them to be potentially of life-saving use. So there's a few things going on there. I mentioned the parent education sessions as well that are being held by school districts. I also expect, as I said, this to be a major focus of the province-wide conference that is focused on the school-age population that we're having with the 60 school districts in the spring of this year.
Member.
And thank you to the minister for that response. And yes, I would take him up on the offer to attend or be involved in whatever that conference is. My next question is, we also know that 81% of the deaths, overdose deaths, were men. So are there or will there be any programs in schools to specifically target boys, as men are severely overrepresented in overdose deaths?
Minister of Education.
Thank you, Mr. Chair. And to the member, I would, I guess, respond in this way. The initiatives and the efforts around prevention and education, which is embedded and is presented in a comprehensive manner throughout the K-12 curriculum for students, where there are discussions of substance use and the risks of it, and how to avoid it from the earliest of ages. It's aimed at all kids. I think she's correct in citing statistics that the opioid epidemic is claiming the lives of males predominantly or disproportionately. But I'm advised that that's most distorted, if you will, for males aged 35 to 60. Now, when it comes to the school system, we don't have boy-specific programs, if that was the member's question. We do have curriculum materials, special supports, different assistance and resources from the provincial health officer and the coroner's office that relates to all kids that are in the school-age population. So that's what the approach has been thus far. And look, we know that we need to help expand the proactive and preventative mental health supports in our school system. This is something that has been a concern of parents and education stakeholders for a number of years. We have seen, for example, the visits to emergency rooms in communities around British Columbia by young, typically teenage kids skyrocket, just more and more visits like that. And that's why we're having conversations with all of the different players in the healthcare system and the different ministries involved in the life of a child, and if it's a children in care, the different ministries to make sure that kids that are at high risk have an adult looking over them in the school setting, but that we have programs that are comprehensive and address the education needs, the prevention strategy that involves all kids in the school system.
Member.
Thank you very much, Chair. And might I suggest look at a very successful program that the Minister is probably aware of, not the Boys and Girls Club, but the Boys Club, that offers strong, a positive male mentorship for vulnerable boys in schools. So that might be something for, because I know that when we were in government, we did support them. But my question is, on Monday, October 23rd, and last year, during estimates in education in this room, I asked another question about resources in schools. And the answer that I got from the minister at the time was, and I quote, "We have endeavored and made a commitment that mental health counselors be available where schools identify the need so that children can get the help they need when they need it," unquote. And I'm wondering whether or not this budget has allotted for school counselors.
Minister.
Thank you, and to the member, appreciate the question. To her comment about the most recent answer, the Boys Club, just to be clear, is an organization that is supported by the ministry, so that the relationship with that organization is ongoing and continues, so that their good work is supported. What I would say to the member about the issue around guidance counselors, teacher counselors, is that the CEF fund has allowed over 1,100 new non-enrolling teachers, FTE teachers, into the school system. That would include teacher counselors. So one of the features of the school system this year that goes along with the record investment that has hired the largest number of teachers and generations in BC is that number, that total, includes a record number of teacher counselors in our school system.
Member North Vancouver Seymour.
Thank you, Chair. And then one more follow-up question from estimates last time. This time I asked a question to the Premier about how the relationship between the new Ministry of Mental Health and Addictions, as well as other ministries, including the Ministry of Education, worked with regards to organization around their budgets. And the response that I got from the Premier at that time was the Minister of Education and the Minister of Mental Health and Addictions would sit down and agree upon a process to go to Treasury Board to get the resources required to meet the needs in our K-12 system. So my question to the Minister is the Minister doing that with the other Minister?
Minister.
Thank you, Mr. Chair, and through you to the member. I would say a few things in response to her question. The coordination between the Ministry of Mental Health and Addictions, Ministry of Children and Family Development, Ministry of Education, and other agencies started from the outset by the creation of a cabinet committee specifically focused on mental health. So it has been a discussion both at the deputy level, the ministerial level, around how we can better align programs and supports, how we can develop new ones that will fill the gap. Part of that work is an expanded conversation that we're having with the federal government, which also is looking at and valuing the importance of improving mental health supports and working with the provinces in that regard. So there's a lot of good things that are lining up in terms of the attention that government and professionals are putting towards enhancing mental health supports in the schools. There's as the member will know, an increased emphasis on this issue in colleges and universities from the executive leadership there that is working with the Minister for Advanced Education, Skills and Training. So a lot of work happening through that cabinet committee that have led to some operational changes and some contemplations of different supports that we may wish to offer in the future. I've mentioned the conference that we're going to convene, which is primarily focused on the K-12 sector, but will be organized in coordination with the other ministries. Additionally, we have added a day for professional development of all the teachers in the province of British Columbia, where we have suggested that school districts focus specifically on mental health and how they can better identify and better support students with mental health issues in their school, how they can promote mental wellness better in their individual schools. That's something that a number of teachers associations and teachers have spoken to me about individually, that they feel that a professional development focus on that would be extremely valuable for teachers who are working with students where these are elements in their school experience, and so we've responded in that regard.
Member.
Thank you. So the professional development that the minister is talking about, would that be a mandated professional development day specific to mental health and prevention and literacy? And if that is the case, would that include an expansion of the Friends program that is a helpful tool for all teachers to help with resiliency with children, anxiety leading to depression? And then my question that I had asked about previously about the relationship between the Minister of Mental Health and Addictions and the Minister of Education was the process of getting more funds into the schools based on recommendations from the Minister of Mental Health and Addictions. So I don't think I actually got that question answered. Maybe a clarification of the Pro-D Day, and then maybe a fine-tuning of the answer of my previous question.
Minister.
Thank you, Chair, and to the member. I mentioned the Cabinet Committee on Mental Health that was convened and that is coordinating the different ministries. I think what the Premier meant was that ministers will go to Treasury Board, which we have done. We have a ministry for the first time, to my knowledge, specifically focused on mental health and addictions that has a substantial budget that was approved by the government. My ministry went to Treasury Board and got approved the largest operational budget in BC school history, so we have significant resources within our budget. In terms of the element of her question that related to professional development resources, I can quote from a letter that was sent last month to superintendents in this regard, and it outlines that we have designated the purpose of a non-instructional day in 2018-19 to include the addition of 5 hours of non-instructional time. Boards are to focus on one non-instructional day on discussions and activities, and I'm quoting here from the letter, that in the board's opinion develop evidence-based approaches to one or more of the following current education priorities: student mental health, sexual orientation and gender identity, curriculum implementation, Indigenous education. So districts will have some choice in this matter, but the suggestion is there. The cost of a professional development day, as the member may likely know, is $40 million, so this is a significant investment. I expect the interest to be highest on the mental health piece because that's based partly anecdotally, but also on some of the survey results that we gather periodically that suggests that the districts are very interested in mental health. So not mandatory, but heavily suggested, and it looks like there's a huge take-up rate on this. And I would add that this is an instructional day that the previous government did not add. Our government added it. It comes with a significant cost, and it's in response to the request from teaching professionals and superintendents and the district elected leaderships in the different parts of the province.